Subarone, myself, and Julie Lindor. It is my understanding that Milan Tyler from Catholic is on the phone.
Yes, Millen Tyler. Outside counsel to Catholic Health Systems.
And Kevin, Connor, you're on the phone?
Yes.
And, thank you. And Tom Prohaska from the Buffalo News, you're on the phone?
Yes, I am.
Is there anyone else on the phone? Okay, if I could just remind everyone, if they don't mind during this meeting, if you could keep your phones on mute, and then when you have a question or it's your turn to speak, then we can put them on. That way we wouldn't have the background noise during this meeting. Thank you. And I'll turn it back to Mr. Chairman Onesi now.
Okay, and if you make a motion, if you tell them to call out your name as well, okay, so that we get that. First on the agenda here is the Pledge of Allegiance. We will say it, although everybody turn toward the flag someplace, okay? I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
with liberty and justice for all. Okay, new business, Catholic Health System, Mr. Gabriel.
Thank you, Chairman. And thank you very much to the board for attending this special meeting of the agency. In particular, this is an action by our LDC, the Niagara Area Development Corporation. What we have in front of you is the application from Catholic Health Systems, Inc. Catholic Health Systems, Inc. is endeavoring on a number of projects, the big project being the development and construction of a 63,000 square foot hospital in Lockport, New York. In addition, there are a number of smaller projects set forth on the Exhibit A to the application, which will also be entertained by Catholic as part of this issuance by the Niagara Area Development Corporation. As a reminder to our board, the NCIDA / NADC is not we are not loaning the money. We are utilizing our LDC to provide taxable bonds to the company, tax exempt bonds and or tax bonds to the company for this project. We have on the line Millen Tyler, which I'll start with Millen, and if Kevin would like to jump in, that'd certainly be great, to give you a brief overview of the projects in question, the use of the funds, and to answer any questions the board members might have in regards to this matter. Millen?
Sure, happy to jump in. The numbers are still being finalized, but in your resolution, you will see that we've broken it out by each location. Obviously, the Lockport project is the biggest, with just over $61 million worth of possible bond financing. The smaller projects are the Mercy project, and again, we've identified what those are: $17 million. The Sisters project, Kenmore and St. Mary's. These are outside of the new construction of Lockport. These projects are primarily to upgrade the existing hospital facilities. You'll see elevator renovation, some repointing of exterior joints, etc. In particular, the Mercy project includes renovation of a cardiac cath lab, which is very important to keep up the high standard of healthcare in the Erie and Niagara region. So we are very excited about doing this financing and injecting somewhere between $80 and $90 million, maybe more, into the local economy to keep up the high standard of healthcare. These will be both tax exempt and or taxable bonds. This will be subject to the approval of the tax exempt bonds by Niagara County, and to the extent that there's tax exempt bonds issued for projects in Erie County, that will be subject to the approval of the county executive in Erie. So we are excited. Kevin, I'm not sure if there's anything more that you want to add about the projects or the process, but we're very excited, and we're happy to answer any questions that the board may have. Thank you.
I think you covered it well. Nothing additional to that. All right. Are there any questions or comments from the board members?
Ross here, it said they will provide better hospital services for our residents in the eastern part of our county. It's a great project just for that, giving them what they should be getting, not receiving at the present time.
Can you comment a little bit about the nuts and bolts of the issuance of the bonds as well as the potential purchasers? Is just to go through that for people that aren't kind of familiar with the way a bond issue of this size goes?
No, and I can say that if you want.
Yeah, you're the expert.
Okay. For the issuance of the bond, it will be done through a public mail, much like the healthcare systems across the country. We use an underwriter, and I think the resolution identifies the underwriter as Bank of America Securities, and we'll be the one that will do the marketing sale to in potential investors. The primary investors will be institutional funds, the mutual funds, and insurance companies who have access to as well. This will be process. We will have the sale process, which will be done over this period, and on the pricing day, based upon the demand of the issuance, the levels are set, and the fixed cost of the capital for Catholics for the new issuance for the funds to keep protected. And I think, as you just meant, the Lockville project in particular, for keeping vital healthcare access to use items in Niagara County.
I'd like to add to the question. What Mark started with, I think, is important for the board to recall, which is the issuer is a conduit issuer. So while they are issuing the bond documents make it very clear that neither the county nor the IDA nor the LDC are responsible for payment of the bonds. The bondholders know that their credit, if you will, is the payments that Catholic Health System will make. So there's no liability, if you will, on the part of the issuer. One other point to note is, again, in your resolution, part of your resolution is compliance with the SECRA Act. And I note that the Town of Lockport Planning Board went through a very detailed SECRA analysis and issued a negative declaration. So the issuer is sort of mimicking that same declaration. That's for the Lockport project only. The other projects are not expanding the footprint or changing the use. So those are under SECRA Type 2, and no action needs to be taken.
Okay. Any other comments?
Yes, Mark, Jerry Wolfgang, I have a question. As I read some of the materials,
seems that Catholic Health Systems is using the funds beyond Lockport, the new hospital, for other projects. Can you explain how they're doing that as far as the actual dollar amounts and where it's going? Or are they using monies that are not yet delegated to any particular project?
Yeah, sure. Millen, why don't you take the beginning of the night and end?
Okay. The answer to your question is the numbers are still a little bit in flux. You know, as we go out to the market and execute contracts and make the exact provisions for each of these projects. But again, you will see in your resolution that the maximum amount for each project is set forth in there. So whether or not we end up using the whole, I'm looking at, for example, the Mercy project. We haven't bid out all of those contracts yet, but the maximum amount that we're asking the issuer to authorize is $17,165,469, and that's just sort of an allocable percentage of the whole up to $90 million they were asking for. So the answer to your question is yes, we have a very good idea what each of the projects is going to cost, and again, we've broken them down in both the application and the resolution that is before you, but we don't have the exact numbers. So even though there's exact numbers in your resolution, those really are just allocable percentages of the whole 90 million. Quite honestly, we think that the borrowing is likely to be in the $85 million range, but again, until we get the actual contracts and figure out how much each project is, we won't know the exact numbers. Did that address your question?
Well, it just makes it unusual that we would appropriate funds through the bond to cover projects that are not yet designated with solid dollar amounts. In other words, you're waiting for the bids to come in before we would even know what the funds you're going to expend on those projects.
What we do, Jerry, is, if I could just tap in, it's actually not unusual in that what we normally do is that the company, in this particular case, Catholic Health, will give us a estimate of their best guesstimate of what the project cost will be with their best use of the specific bonds. And what we end up doing is building in a little bit of a cushion because we don't know exactly what it is. We're not as much concerned with the we are concerned with the maximum amount, Jared. And they would not borrow a dime more than what they need because they'd be paying interest on it. And those monies have to be used at these various locations for these various uses. So for bond deals, this is actually pretty normal. It's just that we don't do a lot of them here. So it seems like it's a little bit different than our normal lease-back transaction, which I know you're very, very familiar with and what our board's very familiar with. So just to let you know, that's the numbers, for example, in Exhibit A, there'll be a 5% cushion on those numbers, to make up what's going to be in the final resolution for this. But we know they cannot go ahead and use this money at a different location for a different project. They're going to be bound by those projects that are set forth.
Is there a chance that they might not be using the total dollar amounts if the bids come in lower?
Yes, what will end up happening, Jerry, is we built in a cushion. We believe the Catholic, I believe, somewhere at least as it stands today, the issuance will be about 85 million, approximately, could be less. Though that number will be a moving target up until the time that it's ready to close. We build in a cushion. In this particular case, I believe it's 90 million, just in case those costs come up, they don't have a shortage, which can kill the project. 100% of the time we build in that cushion. rarely do we ever, does that number get up to that maximum amount. And there will be, yes, for your point, which is a good one, it is likely that and I'll let Millen answer that, but it is likely that the total bond amount will be significantly less than 90 million.
Mark, yeah, Kevin, just a quick question. I would just want to clarify, 100% the county or the IDA has zero risk or responsibility for this. It would solely be the purchasers of the bonds.
Well, the purchasers of the bonds would be the ultimate beneficiary of the payments and the interest on them. It is Catholic Health's responsibility to pay the interest. We have no liability or exposure.
Okay.
Nor does the county.
Correct. And the bond documents have literally capital letters that written all over it. And it is very common. Every bondholder knows this because they know that, the IDA, when it issues bonds, and this issuer, that they are a conduit issuer. So the bond documents will be very clear on the fact that neither the county, nor Erie County, nor Niagara County, nor the IDA, nor the LCC are responsible, and the bondholders are well familiar with that in this market.
Hi, it's Cliff Scott. I just have a question related to the employment plan. For this project in principle, I think that Bill Ross said the facilities at the hospital need an upgrade, and we're absolutely for that. Just have a question relative to the amount of jobs created. Based on the documentation we've received at zero, I see that there's 107 FTEs and about 55 part-time that you're going to retain. Can you explain why there's not going to be not one job created in this whole substantial rehabilitation throughout Western New York?
Sure. Yeah, and I know we have Dave Mack as well, so the primary, because the project is a replacement of existing community, it's not creating jobs in terms of
you're breaking up, sir.
So, yeah,
Kevin, would you like me to take that?
yeah, sorry about that, Dave.
Yeah, there's a lot of background there. Hi, good morning. This is Dave Mack. I'm the Chief Financial Officer for Catholic Health. Yeah, thank you for spending the time today to talk about these important projects. To see for Catholic Health, serving the community, and most importantly, retaining and providing access to healthcare services in Eastern Niagara County is the utmost important to us, given the limited access, not only to emergency medicine, but specialist primary care. And that's what this is all about. So to Kevin's point, if you just examining some of the infrastructure-related projects, it's really retaining and lowering operational risk as those infrastructure projects address some of the aging elevators. We have approximately 92 elevators throughout our system, in addition to working and continuing to maintain the facade of our buildings, which are all brick. These are maintenance in general, but the opportunity by issuing that through the IDA, it really provides us a low cost. And the lower our cost allows us, some of our fixed costs, such as interest, allows us to operate more efficiently, continue to provide services, especially those that have limited access, lower income areas. We do operate those on a loss. So retaining those services obviously maintains employment of all the clinical and administrative functions that support a lot of those clinics and outreach services to the underserved. So focusing on Eastern Niagara County, as we noted, we listed zero, but if you truly think about what's occurring, I know everyone's familiar with the financial challenges and outlook for Eastern Niagara Hospital. If it wasn't for this project, the support that we're getting by the community, we wouldn't be able to do this, to be frank. And it will help retain a lot of clinical and administrative jobs within the region in the new facility, and obviously continue providing healthcare services to the community within Eastern Niagara. As you know, access is a bit of a challenge without driving upwards of a half hour, 45 minutes, depending on where you're living in that region. So we listed it at zero, but there's really a lot of job retention that this is going to create, just maintaining those services within the eastern Niagara region.
And obviously, there's a number of construction jobs as we go about spending all of this money. So those are permanent, but again, it does help with the overall economic impact for the project.
Right. Good point.
You know, you're right, and Tom's on the line, and just make sure you emphasize this. There's going to be spin-off construction-related opportunities for the trade. Those are important distinctions because the paperwork states what it is relative to newly created jobs. Just make sure you hone in on that. Just obviously you have naysayers in who don't like publicly financed or publicly approved projects. Just hone in on that. Make sure you emphasize that. I'm for the project.
It's a great point. Thanks for bringing it up. And I didn't really call out the western side of the county. Some of the work and dollars will be spent improving Mount St. Mary's in Elizabeth. Yeah.
This is Bob. I got a question. Is there any other source of funds in these projects, or is all of the money coming from the bond issue?
Great question. The state has agreed to transfer an existing grant that was awarded to Eastern Niagara Hospital, approximately $5.9 million. Through the final stages of that process, with state officials, they're committed to maintain that support to be used to fund the new hospital. In addition, we've been really blown away by the private support that we're getting through contributions to our foundation for the funding of the project. So there'll be private funding via donations and obviously the state's commitment via this grant that was awarded to Eastern Niagara.
So when I'm looking at this project and I see estimated project costs for the first item, the hospital, $73 million, and then I see estimated taxes and bonds for that $60 million, that difference is coming from somewhere else.
Correct. It's the grant, hospital equity donation, private donation.
Gotcha. Thank you.
Hey, Ross, this needed project, it must be remembered that about 65% of this 85 to 90 million will be spent right here in Niagara County for new and renovations, which is kind of nice, about 65%. Keep that in mind.
Bill, this is Mark. Actually, it's closer to 75%. We did the math.
It's a little off, but
It's fine. And to keep in mind, one thing in speaking to Millen earlier and David and Kevin, one of the questions I had was the fact that they were doing this project, and I wouldn't mind David having a comment on this during this very strenuous the time for healthcare institutions during COVID and at this point in time. David, if you don't mind, just a quick word on the difficulties and how this type of help will really go a long way in getting through this time.
Well, thank you for bringing that up. Obviously, COVID has wreaked havoc across the healthcare industry as a whole, but it's been further strained by some other recent regulatory changes, including required vaccination for our clinical workforce. We're really struggling. Obviously, the cost of COVID is pronounced, and I won't drag you through the past 2 years of what we've been living, but the average loss for supporting patients that was affected by COVID is almost $25,000 per case. That's how much we lose, where our costs exceed the reimbursement we receive. So it's not to mention upwards almost a $200 million drop in revenue related to cancellation of elective surgery and just lower utilization as consumers are just afraid of healthcare. It's returning slowly, but 2020 was a devastating year for us.
even with some of the federal funding that we received through the CARES Act, we still lost substantial amounts of money. And even year to date, we're running through August, a $65 million loss across our health system. So when we look at projects like this, if it wasn't for support from the communities, this would not happen. Anne McCaffrey is an exceptional leader. Her courage and willingness to work with us to find solutions to very complex problems. But it involves more than just Anne and the administrative team at Catholic Health. It's really the community and everyone stepping forward to help make this project happen. Because given some of the labor shortages, spending on agency personnel and other operating challenges, in normal times, without the support, this project would not be moving forward. Eastern Niagara will eventually close, and it really curtails access to these services. Because if you look at the project itself, obviously we're continuing providing emergency medicine, inpatient. We'll have an inpatient unit to manage observation and medical admits, but we'll continue, leveraging our health system and other providers for surgical services. But almost half of that site will be primary care and specialists, and really improving access. So the members of the community do not have to drive all the way to Erie County to try to get into a specialist. We'll bring them to the region. That's probably the most important piece of what we're building there. In providing primary care services, Catholic Health does not turn away anyone, regardless of ability to pay or coverage. And that includes specialists, that includes primary care. And our goal there is to provide those services to those that are underserved. So without low cost financing, projects like this couldn't happen. It's just the overall cost is just prohibitive for the system to sustain.
Okay. Are there any other questions?
Yes, I have one. This is Scott Bridges. I have one. With the different state incentives and bond financing, all this stuff involved, would that trigger the new prevailing rate laws for the construction of the job? I know there's some sort of formula, the 30%. I'm not sure the exact details, but I thought I read different things where they were getting, where Catholic Health was getting $12 million from the state. Different numbers have been thrown around over the last 6 months, and I'm just unsure of all that stuff. So the question would be, would it trigger prevailing rate for construction?
This is Millen Tyler. The short answer is no. That statute that you are thinking about was passed last year, and it takes effect January 1 of next year, of 2022. So, the timing is such that it will not affect this project.
Okay, then a second question. Would the bond financing that the IDA is looking at, does that still trigger the local hire policies through the IDA?
Yes, it does.
Okay.
Yeah, under our local policy, which we provided a copy to that at the outset to Kevin and Catholic, that it's our local labor policy.
Okay, and then just one last thing I noticed on the paperwork we were emailed, it said, did the project begin yet? And the answer was no on the paperwork. And I had heard that they had been moving dirt around on site, and they had come into some artifacts or something, so the project had stopped. Is that a true statement, or?
So you're correct. It looks like site work. It's not in prep of constructing the building. It's exactly what you mentioned. It's the due diligence from an archaeology perspective to ensure there's no artifacts. And so I don't know the technical nature of this, but they turn over a couple layers of soil in that where the building will be constructed to identify if there's any artifacts. They did find some arrowheads, based on what I read through the reports. They believe it was some sort of hunting diligence as part of the purchase of the property related to that type of review. So it's no site prep has begun. It's more focused on this archaeology site examination.
Okay, thank you.
Any other questions? Okay. I guess we need a motion to put this before the full board.
So moved, Jerry Wolfgang.
Second, Ross.
Okay, all in favor?
Aye.
Aye.
Okay. Any opposed?
We'll need a roll call on this. Yes, please.
Yeah, we need a roll call.
Mr. Wolfgang,
Yes.
Mr. McCabe,
Yes.
Mr. Ross,
Yes.
Mr. Cliff,
Yes.
Mr. Bridges,
Yes.
Mr. Scott,
Yes.
Mr. Krumpa,
Yes.
Mr. Onesi.
Yes. Motion carries. Thank you. Is there any other business, Mark?
No, that is the only thing on the agenda today, Mr. Chairman.
Anybody have any other questions or things they want to bring up before we close out here?
Our next regular scheduled meeting will still be on October 13th at 9 o'clock.
That Zoom meeting or regular meeting?
We're going to have it noticed as the same COVID meeting. We'll be doing that for the next few months for those people who are not comfortable coming into the agency for the meetings. However, the boardroom will still be set up, and certainly our board members are welcome to come to the agency in person if they choose to participate that way.
Good.
Okay, great. Well, I want to thank everybody for their time this morning, and I'll make a motion that we adjourn.
Second, Clinton.
Okay, all in favor?
Aye.
Aye.
Any opposed? All right, thank you very much. We'll see you on the 13th.
Thank you.
Have a good day.